Hi, folks. I'm Ryan Mallory with Southern Oregon First and the producer of the Wake Up Southern Oregon show. For this show, we have the leaders of the Maskless Women of Southern Oregon and a lady from Faith and Freedom who are going to read testimonies from medical workers locally that have been in contact. And originally that was about 20. Now it's way more than 40. But they're going to read some of the testimonials from very intelligent, highly skilled people in the medical industry that have a problem with being forced to have a vaccine. And we'd like to give them a voice because their jobs are in jeopardy if they speak out. This is why we're meeting on the 25th, this Wednesday, in front of Rogue Regional Hospital on the sidewalk. Stay out of traffic. Be safe. We want to be quiet. We want to be friendly. And we want to meet there at 4:45 for a quiet prayer walk around the regional hospital. And that will end with a meetup to support those workers, as other workers should be supporting them that have even had the vaccine in their religious and medical rights. So we hope to see you there, and I hope you enjoy the testimonials. This is what's really going on behind the scenes, and we'd like to give these folks a voice.
I'm an RN at Asante, and we are in crisis. It's not what you might think. COVID is a huge issue, but it is not the only issue. This past year, society health has plummeted. People have been coming to the hospital at alarming rates and in terrible shape. Gone are the days of someone simply arriving for a broken leg or a minor illness. Yes, some COVID patients are also very sick, and some die. But my average COVID patient is no more ill than the average non-COVID patient, oftentimes even less. For example, the last half dozen patients I've had who struggle with acute respiratory distress tested negative for COVID.
Inside testimony from an EDRN. I am so damn frustrated every time I see these headlines on social media and then in the comments people blaming the unvaccinated. If I truly believed the vaccine worked or was necessary, I would have got it. I'm not alone. 25 of my coworkers in my department alone feel the same, and we are the ones who see every single COVID patient that comes into the hospital. Hospitals are reaching capacity due to staffing issues and bed space. There is such a backlog of people who have nowhere else to go. Then add in burnout and nursing shortages, which means there are way less nurses available to care for patients, which means capacity. It's that simple. Up until a month ago, our hospital sent an email daily telling us how many new cases and how many deaths and how many COVID patients we have in-house. Those emails have totally stopped.
If you look at the vaccine adverse events reporting system, there is a clear risk with these shots. In the months since the vaccine has been used, the vaccine adverse events reporting system has reported over 12,000 deaths and 46,000 hospitalizations related to the COVID vaccines. And it's known that only roughly 1% of these effects gets reported in the system. Medical decisions cannot be a blanket statement or a one-size-fits-all because we are all different. We live in a country of freedoms, and those freedoms are slowly being stripped away from us, and these mandates are for the greater good. When the government starts overstepping their boundaries to force something on the population is when people need to stand up and fight for their rights.
Speaking of numbers, roughly 25% of my COVID patients have been vaccinated. This number is most likely even higher due to reporting issues. Only patients who have been vaxxed through Asante, my chart, show up as vaxxed. Everyone else shows up as unknown. Yes, COVID is a huge problem, but mostly because of its contagion rate and because of its severity. It's a volume issue. Too many patients, too little staff.
So I want to add that we are seeing a ton of fully vaccinated COVID patients come into the ED daily. I have yet to see a patient who has COVID for the second time. A group of us from my department have joined forces and come together and have started a list of staff members from over 30 modalities within our hospital. Highly educated medical professionals who join together in solidarity against a vaccine mandate. Contrary to what the mainstream media is reporting, there is a large amount of healthcare workers who have cared for COVID patients this entire pandemic who still say no to the vaccine.
Right now is the time to stand up. It is time to be standing up for medical freedom and informed consent to make our own health decisions. Even if you have decided to get the COVID injection, you should be standing up against these mandates because this is about more than just the injection. It sets a precedent that the government can mandate something and take away your right to informed consent, bodily autonomy, and medical freedom. If you don't stand up and fight your rights now, there might not be a chance for them to fight later.
I just hope we recognize how critical this shortage is and protect medical professionals from the looming vaccination mandates, which would force them to choose between their career and their medical freedom. Such a mandate could potentially drive hundreds out of the field. I fear already suffering hospitals won't withstand the blow, and those in need of medical will pay the price.
In conjunction with this list of over 200 staff members and growing daily, we sent a letter citing sources from articles the CDC has published in the last few weeks that undoubtedly support our stance. This letter is an attempt to show the hospital what they stand to lose and ask them to take a stand and advocate for their staff. We presented this letter to senior management last week and are still awaiting a response. I do not know what will happen in the coming months and what healthcare will look like, but I'm scared. I know that in my heart that this is a fight God has called me to fight. I personally do not care what anyone chooses to do with their body, but when the government or anyone else starts to tell people what they will do to their body is where we as a society need to stand up and say enough is enough. I meant to add in that we have been called stupid and uneducated by vaccinated doctors. The lateral bullying has been awful.
I'm a registered nurse who works in critical care at a local hospital, and I have taken care of COVID patients firsthand. For me, this isn't about COVID if COVID is real. It's obvious that it's real, but I believe it's been politicized since the very beginning. When they started showing a death count on the news, that's when it became about fear and division. It's been about masked versus unmasked, vaccinated versus unvaccinated. I personally believe that our medical freedom is at stake with these vaccine mandates. It isn't about being pro or anti anything. This is about the right to have a choice of what you put into your body and a choice of medical care. It is a slippery slope that we are on. Where there is risk, there must be a choice.
I can tell you that I have confirmation that at Asante, they aren't even testing for the Delta variant. So how can they post about how much worse it is when they have no confirmation that it even exists? It's a blood test, from my understanding, and they aren't even doing it.
The most frustrating part of this entire situation for me is that the medical field has remained largely silent when it comes to what can actually help maintain and boost a healthy immune system. If this was about health, they would be mandating vitamin C, zinc, magnesium, regular exercise, and healthy nutrition. They would be encouraging people to be at a healthy weight, to manage the controllable factors of their health. They would be bribing you. They wouldn't be bribing you with donuts and cash to get the shot, but it's not about health. It might have started about being about health, but now it's become all about power and control. It's time to get loud. It's time to stand up for our rights and not comply with these mandates.